here with my husband Adam, who's an engineer, and my 3 kids. So let me give you a tour of our hospital. From here, you can see. Renani, Zahiri Maskin. What is the Zahiri Maskin. Hi. Okay. Don't forget to greet people. That's a very important part of our hospital tour. Here is the eye and dental clinic. We have a full-time dentist, and we have a now operational suite with an optometrist and a current ophthalmologist.
Hello.
Make your way inside. There's the ophthalmology OR right there. And then down this hallway is the eye clinic and our dentist. This is Dr. Million. Hi. Zahiri Maskin. Okay. And as we make our way through the hospital, we're going to be walking right along our pediatric ward and some of our administrative area. So the weather in Ethiopia is really nice. We're up in the highlands, so right now the weather's pretty perfect. It rains a little bit, but generally it's like 70 to 80 degrees Fahrenheit. We have nice jacaranda trees, pine trees, and the burden of malaria is really low here, so none of us take any malaria prophylaxis. So a nice added benefit of living up in altitude. This is the beginning of our pediatric ward, and then I'll take you to the emergency room. So this is maybe I'll take you just to kind of how the patients make their way through our hospital. So when they show up at the hospital, the first place you're going to go is the triage area. So here's the front of our hospital right here. We'll make our way through the crowd a little bit.
Salam.
Everyone starts their medical care here at the triage room. Here's Sister Mahira, she's our triage nurse, and some of our patients. From here, then they get a card, and then they make their way either to the emergency room, which is this direction, or our outpatient department. The outpatient department is new. We just opened it 2 days ago.
Wow.
But this is a common area where everyone is waiting for their outpatient follow-up. So you can see all the way around the room. Our outpatient area is mostly run by general practitioners. We have an internal medicine clinic, we have a pediatric clinic, and then we have outpatient clinics for general surgery, orthopedics, eye, dental, and OB/GYN. So this is our emergency room right in here. Hi Mary, good morning.
Hi.
And then if you need any investigations or laboratory work, this is kind of like the common area. We have an ultrasound with ultrasound technicians. We have a laboratory, and then we have a digital X-ray and CT scan. So here's our lovely laboratory. We always like having guests come to visit our laboratory. So here's the inside here, and through God's grace, we just opened up an official microbiology department. Here they are getting it set up.
Hey.
Hi, you guys are being videoed. Hi Tishale, hi Yesta. But it's been a great blessing. We just have someone complete their master's in microbiology. We just started doing blood cultures a couple months ago.
Very important. Very big.
This is our radiology radiology department. We currently have one Ethiopian radiologist, but we have digital x-ray, we have fluoro and C-arm, and we have CT scan, which is really nice. And so this is the main corridor down our hospital towards the OR pavilion. So Soto Christian Hospital is a PACS training site.
Hi.
And so PACS is the Pan-African Association of Christian Surgeons. So we have both a general surgery training program and an orthopedic training program. This area on the other side of this pavilion is going to be where our new surgical building will be. And next to that, we have our old surgery building right here, where we have the surgical department and then our ICU on the other side. I'll give you a full tour.
So,
So this is our newest building right here. I guess maybe second newest building. It's not finished yet. This is going to be our new oxygen house. We're working on an inline hospital oxygen gas project, and I'm hoping one day God will gift us with an oxygen plant. So any good hospital, it's not all about the physicians, but it's about your support staff and your support services. So an important part of our surgical department is our physical therapist who does all of our casting, as well as his support. And there's a crutch room. So here there's a ministry on site called Emmanuel Disabled Ministries. They make all of our crutches. They have a room right here where they make their own crutches and sell them for our patients, which is pretty novel. And then over here is the entrance to our operating room. Here's our physical therapy room where they do a lot of the casting as well as physical therapy if necessary. And then here is our OR. We're not going to go into the sterile areas because we want to respect the surgeon's hygiene, but we currently have 6 operating rooms. We have 3 of them are functional for orthopedics, 2 are general surgery, 1 is OBGYN, and we have a minor procedure room with a colonoscopy and an endoscopy suite. And so our rooms are pretty full and stay fairly busy. We're generally thought of as a trauma hospital. There's a lot of road traffic accidents in Ethiopia, and in fact, some data suggests that Ethiopia may have the highest per capita road traffic accidents in Africa. And so, as a result, we have a lot of acute trauma patients that come, as well as many orthopedic patients that make their way here. This is Mulu. He's our biomed technician. You're on video, Mulu.
hi, Miller.
Wave hi. He works a lot with Adam. We love having visiting biomedical engineers to help fix our things and work with Mulu in order to expand our capacity.
Very good.
This is the way to our intensive care unit. Our ICU has been expanding over the last few years, and we currently have about 3 ventilators and some IV pumps, and the capacity to do the best we can to take care of our critically ill patients. This is the ICU here. It's not so full today, but oftentimes we can have up to 6 patients in our ICU. It's a 6-bed department, and we have our post-anesthesia recovery unit right here. So in the future, on the other side of this, they're currently building a new surgical pavilion that will have 8 ORs, and then the ICU will expand once that happens to have more beds and more capacity. our kitchen where they make all the food for our hospital patients. Here, you can go in and look. It's a nice kitchen. So Ethiopian cuisine has a lot of cabbage, carrots, lentils.
Hello,
There's the
Salam.
ladies. They're having tea break, which is nice. We in the past have had dietitians that have come and help out in our kitchen. Here's the hospital cafeteria, where people can come and order food and have tea and coffee. Maybe I can show you the chapel. We'll see if it's open. It's often closed if it's not in session. But we love having guests that invest in our chaplains because our hospital mission and vision is threefold. It's to provide excellent medical care, to make disciples, and to share the gospel. And so this is an important part of our hospital. We have chapel every week, we have weekly Bible study, and our chaplains go around and pray with all of our patients. And so short-term guests that come and invest in our chaplains is a really wonderful way to spend time in our hospital. So this is the main corridor of our hospital. We currently have 4 wards. So the first ward right here is the orthopedic ward. We'll just take a quick look down the main corridor. Okay, this is the main corridor right here. Our orthopedic ward is the busiest department in our hospital. And it also has the residents that work with them through PACS. So we always love having short-term orthopedic surgeons that come. We're currently actively recruiting another long-term orthopedic surgeon. We welcome anyone to join the faculty of our residency program. Here's the general surgery ward. Most of the wards look pretty similar. This is a common patient room. And then most of the rooms, we do have some private rooms, but most of them are either 2 to 6 patients. Oh, selamat not you. It's not you. It's not you. Our next department is our maternity ward. We have our postpartum moms, our antepartum moms. The delivery room is in there, as well as our new NICU. The NICU was developed in the last couple of years. And so the department is full. We have about, I think we have like maybe 8 to 10 Ethiopian midwives that help to run the department, in addition to the nurses and our OBGYNs. And so the department stays pretty active. Currently we have on average 80 to 100 deliveries a month, in addition to GYN cases. Here is our OBGYN department. We have private rooms for our moms as well as our babies to go in.
Hi, salam.
Wait here. Okay, it's currently empty. You can come in. This is our delivery room right here. We oftentimes just have one, but sometimes we'll have 2 women in labor. And then this is our labor room, or our laboring room. We have 4, and maybe even up to 6 beds if we need for laboring moms. Today it's not quite so busy. But again, our average delivery per month is about 80 to 100. Here's our... Okay, here's our neonatal intensive care unit. It's a small room. This is one of our lovely nurses. Hi, Ainu. Say hi to the camera. You're being videoed. Salamta. Hey, hey.
Hello.
That's when the power went off. Those large alarms are because we currently do not have power. We're waiting for the generator to kick back on. This is our medical and pediatrics ward. And so we have an internist, we have a family doctor that works in the pediatric ward, and a pediatrician here, as well as our general practitioners are with us. One of the nice things about our hospital is you never work alone, because language can be a barrier, and because local knowledge can be challenging, and the work can be heavy. We always have young doctors that work with us in each one of our respective departments. So this is, for example, our pediatric ward. You can see there's some nice pictures on the wall. We have about 8 beds in here, as well as a few patients.
Hi.
So I think that nearly completes our tour of the medical services. But I would strongly encourage everyone to remember that a hospital is not run on the backs of physicians. A hospital is run on the backs of pretty much everyone else.
Yeah.
And so I want to end our tour by taking a look at our biomed department. Some of our most productive guests here have been people that come to work alongside our plumbers, anyone with construction, people that work alongside our biomed technicians, as well as many of our other support services. And so God can use any of your skills for His kingdom, and likely even within this hospital. So, this is the entrance to the emergency room. You saw it from the inside. Here's the outside. And then here is one of the most important buildings in our hospital. This is the generator house, right here. We have 2 generators on campus. They often need maintenance, some help and repairs. And so we rely on visiting engineers. My husband is among one of them. We have a local electrician, as well as a local plumber, who are constantly in need of extra help. The workload of the maintenance staff is way beyond their capacity. And so any additional help is something that they highly value and feel really supported and encouraged through any of our kind of more maintenance, construction, short-term visitors. And so here's our biomedical department. We'll see if it's open. No, it's closed because we saw Lulu around the hospital. We have a biomed department, we have a wood shop, we have a plumber, and we have a welding shop because we fabricate most of our hospital equipment here on site because it's hard to import things. So you can see we have great need for, here's our wood shop. We'll just step in here. Here's the wood shop. They're constantly making and repairing different things. And then here's our metal shop. And you can take a look. They have a bunch of different projects that are going on here. So, thank you for your joining us on our full tour of Soto Christian Hospital. We're so glad to have you. Please feel free to contact us or anyone through Christian Health Service Corps if you're interested in short or long-term volunteer opportunities. Thank you.